My name is Haripriya Maddur. I'm a transplant hepatologist at the University of Arizona in Tucson. So as I mentioned earlier, it's really important to first stratify these patients. If these patients don't have any evidence of fibrosis and they don't have any risk scores, in fact, these are patients that I actually would then send back to their primary care, making sure that they are aware of dietary modification and the need for exercise. So let me get into that a little bit more. Often, a lot of patients are just told to lose weight, but it's not simply a weight loss that needs to be done. It's actually changing the diet. We have a society based off of ultra-processed foods and high fructose corn syrup consumption and a lot of sugary foods consumption. So it really requires modification. So doing more of a plant-based diet, the Mediterranean-based diet, and avoiding processed foods, avoiding sugary foods and saturated fat-containing foods, and really changing over to a more whole food diet. So that's the first prong approach. And then in terms of exercise, one of the major risk factors for fatty liver disease is a sedentary lifestyle. So really it's important to tell patients to exercise more. And so that's about 150 minutes of just moderate exercise, which sounds a lot, but it's really like a 20-minute walk daily, or 70 minutes or more of vigorous exercise. So really the major things I tell patients at early stage is changing their diet around, working on weight loss, and also just stop being a sedentary and to try to be more active. So when patients have cirrhosis and fatty liver disease, it's still important to make sure that their lipids are managed, that they've changed their diet. But my treatment approach changes somewhat in that a lot of these patients are at high risk of developing sarcopenia or loss of their muscle mass. So I really ensure that they are getting a high protein diet, as well as making sure they're getting a late night snack so that they're not breaking down muscle mass prior to bed, so that they're not continuing to become more sarcopenic and worsening their liver disease. When we are considering risk stratification for liver transplantation, we obviously, first, when we determine if someone needs a liver transplant, we make sure that their MELD scores are high enough to require liver transplant, that they're decompensated. And so that's basically liver transplantation in general. But specific to patients with fatty liver disease, it's really important to make sure that they are stratified from a cardiac standpoint, because cardiac disease, or cardiac death rather, is one of the major causes of mortality in patients with fatty liver disease. So it's really, really important that we make sure that they get a very good cardiac assessment so that they don't have cardiac complications either intraoperatively or in the immediate postoperative period. Also, it's really important that they get adequate screening for liver cancer. We do this for all of our patients who are being evaluated for liver transplantation, but specifically in patients who are transplanted for liver cancer or hepatocellular carcinoma, fatty liver disease is the #1 cause. So it's really important to make sure that they don't have liver cancer, because that is a very huge risk factor in the setting of fatty liver disease. So bariatric surgery is a fantastic tool for select patients with fatty liver disease. And in fact, it actually can lead to a significantly higher reduction in weight, about 15 to 20%, as opposed to diet and exercise alone. So you can actually have significant improvement in these patients. Typically for patients who have a BMI greater than 40, bariatric surgery should be considered, or those who have lower BMIs, typically 35 to 40 or 30 to 35, if they have uncontrolled diabetes and hypertension. One word of caution is bariatric surgery should be very carefully done in patients who have cirrhosis. You need to first off make sure that they don't have portal hypertension, otherwise you can decompensate them. And it's not recommended if they have decompensated cirrhosis, because it actually can tip them over the edge. Nonetheless, for a patient that is non-cirrhotic or is a well-compensated cirrhotic and has a significantly elevated BMI, bariatric surgery is a fantastic tool.